study we presented in ACTRIMS had to do basically to look for the prevalence and the relative burden of psychiatric morbidity in individuals with MS in the 5 years before MS onset, and we did that compared to matched controls. So basically, what we did is we analyzed a data platform of both administrative and clinical information from British Columbia, Canada, and we identified individuals with MS, and we matched them with controls from the general population, and we matched them by sex, year of birth, and postal code. And these individuals did not have to have any demyelinating disease claim. And so what we did during that period was to look for the presence of any psychiatric morbidity during this 5-year period before MS onset, and compare this prevalence between MS cases and controls. And we also compared, besides this, we also compared what we refer as the burden of psychiatric morbidity, and this was basically the rate or the yearly rate of physician visits for any psychiatric morbidity, visits to psychiatrists, psychiatric-related hospital admissions, and as well as dispensations of a group of medications or a group of psychotropic medications throughout this period. And basically, what we found in terms of the results was that overall, the prevalence of psychiatric morbidity in the 5 years before MS onset was higher for MS cases compared to controls in both the administrative as well as the clinical cohort. And so overall, this difference was, the prevalence was 28% for MS cases and 15% for controls for the whole 5-year period in what we define as the administrative cohort. And for what was the clinical cohort, this was the overall prevalence was 22% versus 13%. And so this, then we calculated or we estimated the relative risk of psychiatric morbidity for the whole 5-year period, and this was 88% higher in MS cases for the administrative cohort and 57% for MS cases in the clinical cohort. And with regards to the secondary analysis, so this was the number of physician visits to psychiatrists, hospitalizations, and psychotropic prescriptions. We also found increased rates of all these 4 outcomes in each of the year before MS onset, with a peak highest rate observed in the year before MS onset. So, for example, for physician visits, this rate was approximately 80% higher in MS cases compared to control in the year 5 before MS onset, and this went up to 125% the year before. For visits to psychiatrists, these differences were more pronounced, with rates of visits that went from 130% higher in the year 5 before MS onset to almost 150% higher the year before. And for hospital admissions, similarly comparing the year 5 to the year 1 before MS onset, the rate of visits went from the rate of admissions went from 130% higher to almost 200% higher, and the rate of prescription of psychotropic medications went in the year 5 before MS onset went from 75% higher to 100% higher the year before. So overall, we found a similar difference between the 4 outcomes, with this pattern of continued increased rate, with the highest rate registered the year before MS onset. So that's pretty much the results we observed.